Well, the first moment of life for a human being in this country is a pharmaceutical intervention. All right, upon birth, upon coming out of the womb, within seconds, antibiotic ointment is spread across the child's eyes. That's just mandatory, essentially. And then within the first hours of birth, it's the Hep B shot, which is an STD. Hep B is an STD or intravenous. You get through intravenous needles through drug use. There's no documented cases of any other ways people getting it than that, and the mom is tested for it. So we desensitize, I think, Americans within the first hours of birth, and then as the pediatric industry is overseeing a metabolic health crisis among children, as I mentioned, where statin rates have doubled in prescriptions. Antidepressant rates have doubled in the past 5 years. Metformin is now being prescribed to high schoolers like candy. The obesity, every single condition you can name, autoimmune conditions, kidney disease, they're all at an all-time high this year among kids. And that's driving 90 to 95% of medical spending. It's driving really the bulk of what's torturing Americans. And yet pediatricians don't talk about that. They're actually not weighing kids anymore because they've been through a whole TikTok campaign funded by processed food companies. Doctors don't weigh people. They don't talk about weight, even though 100 years ago, an average person you see at the mall today in America, they literally, an overweight person was in the circus 100 years ago. Like it was so rare. There were case reports written about obese people. Doctors wouldn't see them over their entire career. So in the midst of this kind of happening among kids, all pediatric medicine is whether you're taking pharmaceuticals, and then the American Academy of Pediatrics, which gives them basically required reading on dietary interventions, is literally paid for by Coca-Cola, Cadbury, other processed food companies, and they create guidance saying that the first thing your child should eat is processed puffs, not whole food. So yeah, we've really got some really, really tough incentives there. Chronic conditions, anything that's not going to kill your kid right away, but is like a long-term issue like high cholesterol, blood sugar, mental health, the medical system does not deserve your trust. If you have an acute problem, if something's going to kill your kid right away, if something's like an infection or, is some kind of acute illness, the medical system is a miracle. That's 5% of medical spending right now. The medical system has completely lost their way on chronic conditions, and we really should not be trusting the system on that. And we should be taking a big pause when our doctors are trying to push a pharmaceutical or dietary advice on our kids.